What is cancer? Till now, many presentations were about cancer as a disease from the medical oncology point of view. I would like to bring into attention that cancer, it's more than a disease. Cancer is also emotions. As human beings, we are, let's say, made also from emotions. We are human beings, so we are thinking, and we care about ourselves and about the others. Therefore, cancer remains a very important disease from a psychological point of view. Cancer, as I mentioned before, is emotions. The first emotions that come into our mind is fear. Cancer is fear. We have to admit this. What that means? That means that the word itself, fear, stirs up with an imminent danger. Something is going to happen. When I received the diagnostic of cancer, my body is entering in a defense mechanism because something is going to happen, because it is a danger. Fear is always associated with danger. Moreover, cancer is sadness. The word itself suggests that something or all might be loose. We are very sad when we receive this diagnosis, this oncological diagnosis. We are very sad because within 24 hours, which means pre-diagnostic, diagnostics, and post-diagnosis phases, we see our whole life once and all. So sadness is a consequent emotion after fear. Another list is anger. The word itself can bring into attention the fact that we might have a limited life. Anger with sadness are the two emotions that, along with fear, create or is the base of the or the foundation of the future trajectory of every oncological patients from psychological point of view. Psychological point of view, which for sure it will influence also the medical acceptance or the treatment acceptance of medical oncology. As I mentioned before, despite the progress in medicine and technologies, as everybody knows, we are living tremendous times in development of technologies regarding cancer disease. But cancer remains a persistent disease. Cancer remains a danger, as I mentioned before. Regarding fear and why I choose for my intervention fear, I choose it because fear comes as natural. Fear is the first emotions that every oncological patient experience when hear the oncological diagnostic. Fear, as I mentioned here, is something primordial, yes? It has a history, it has a culture, and ultimately it has a purpose. Fear is the only negative emotions out of all the emotions that a human person can experience. Fear was the first emotion that a person ever experienced in the history. Moreover, fear led to this emotional troika, as I name it, anxiety, depression, and suicide. That is the most dangerous issues for every oncological patient. If we, as psychologists or clinical psychologists, we are not working with a medical oncological team together in a multidisciplinary team. This anxiety, depression, and especially the suicide danger are increasing very, very much because of the fear. The oncological patient, from psychological point of view, when he hears the fact that he has cancer, for him, everything is lost. He enters in a new reality. It depends on him in the first place, but it depends also on us to see or to create or to explain or to show or to prove how this new reality will look like. The life for every oncological patient will never be the same. But the most important thing is that not only the patient life will be changed, but the life of his family, which represents the first line of defense in the fight with the cancer. The whole structure of a cancer, of a family with a cancer patient is changed. So everything has to be and will be restructured, rethinking. As I mentioned before, fear of recurrence is a broad concept marked by a focus of emotions on latent symptoms related to cancer. Even though fear of recurrence is a broad concept, I have to mention the fact that it's a quite new concept on the psycho-oncological field. It was developed in 2017 for the first time by Dr. Sophie Lebel, with whom I had the pleasure to have an interview. After she developed this concept, after, I guess, 4 or 5 years of studies, and it is in a permanent, let's say, debate how we could improve this fear of recurrence. We can't say in our, let's say, in our daily patients or daily counseling, which patient will experience fear of recurrence or which not, which patient will experience an increased fear of recurrence or which patient will not experience at all. We can't say how much this fear of recurrence will impact the future trajectory of cancer patients, the treatment of cancer patients. But for sure, this fear of recurrence will remain for the patient as long as he will live. So the official definitions, as Dr. Sophie Lebel mentioned, is fear of cancer recurrence is defined as a fear, worry, or concern that cancer will come back or progress. I want to accentuate not the fear, but the other two words, worry and concern. So fear of recurrence, it's fear, it's worry, it's concern that cancer will come back or progress in the same organ or in other organ or in other types of cancers. Fear, as I mentioned before, it's a natural emotion. But worry and concern, it depends on every oncological patient. Worry, it is very important to mention this. Worry, it's the biggest challenge and the biggest threat for every oncological patient. Why? Because worry is something in the future with a probability or possibility that might happen. But in 90% of the cases, it will not happen. So the oncological patient is already worried about something that it will never happen. There are cases, and Dr. Sophie Lebel presented very nice to a patient that she was thinking so much, worry about the cancer recurrence so much that she almost reactivate her own cancer only by the power of emotion. She was so worried. She was thinking all the time that the cancer is there. The cancer is there, even though after the first session of chemotherapy, the cancer wasn't there. But she was convinced that she will have again that cancer. It depends on every oncological patient to understand that fear, it's a normal emotion, but worry and concern, it depends on every patient point of view. This is an image just to simplify the definition. Yes, we have feelings after the oncological diagnosis, which create our thoughts, which create our behaviors, and so on and so forth. We see that feelings and thoughts create our behavior, how we think, how we feel. Of course, an oncological patient, it's not rational. This is a fact. We all agree with this. He lives in another reality, but our job as psych-oncologists is just that, to help the patient live in the quotidian reality, not a parallel reality or another reality. Therefore, we have to reduce this fear, in our case of recurrence, but also the fear of progression. So their thoughts to be positive, and in this way to affect their behavior to continue the treatment, the medical treatment, and for the body to accept the treatment. Because if you are so frightened that cancer will never leave or cancer will progress, the body will accept very, very hard the medical treatment. And there were cases where patients didn't follow the medical treatment, the chemotherapy, the radiotherapy, because of the fear that they were doing for nothing this treatment. There are some issues in the specialty literature that I want to mention here that sometimes create confusions. Fear of recurrence versus fear of progressions. Even though the two terms, recurrence and progression, might look different, we are talking about progressions as fear of recurrence. There are not till now evidence that an oncological patient, when he experiences fear of recurrence, can make a difference between recurrence or progression. For him, it's the same. Because the fear, it's so powerful that he can't make this difference. If you ask him, why are you afraid of recurrence or progression of your cancer? He can't answer. He just said, I'm afraid of the cancer. So for the moment, they are not two different concepts. We are talking about one concept, which is fear of recurrence, which include this fear of progression. As I mentioned before, fear versus worry. It is okay to be fear. It is a normal emotion, but worry is something else. Worry is something that oncological patient creates with his power or her power of mind. And not the least, what is the most important for you in this moment? This is a question that I always ask patients. Why? Because they are asking me how other patients in my situation succeed to overcome this fear of recurrence or to overcome the cancer. And I always ask them, think what is the most important for you in this moment. And more than almost 100% said, I want to be cancer-free. So if you want to be cancer-free, let's work together. Let worry apart and just concentrate on the fear and start build the hope. Because the hope is the opposite of the fear. Hope, it is that emotion, the concept, however you want to mention it. Hope is the only thing that motivates every oncological patient. Here is a picture of the challenges of returning to a normal life on our reality. Yes, a normal life as we can define it on nowadays, for example. And we see that 8% out of 10 experience physical difficulties, included cancer-related fatigue. 7 out of 10 people reported emotional concern, including fear of cancer recurrence, and 4 out of 10 said that they have practical difficulties in returning to work. Not in the end, I will want to mention the factors, the most important factors associated with fear of recurrence. The first one and the most important, it's age. If we are talking about adolescents and young adults, the fear is not so increased. But if we are talking about elderly people or let's say a parent that has cancer at the home, children are waiting for him, the fear is very, very increased. Another important factor is socioeconomic. The majority of oncological patients, as we know, can't afford an oncological treatment. Therefore, this fear of recurrence, it is very increased for them, because I know many cases when patients overcome a type of cancer, but on the second cancer, they can't afford to do the treatment. So this fear of recurrence was very, very high. Another factor is anxiety, all with which is related to do radiotherapy, to do CT, to do whatever the medical treatment means. Level of educations, not in the way of educated or non-educated people, but the access of psycho-education. If we have a psycho-oncological education in every community, the level of fear of recurrence for sure will decrease. But since there are countries, regions that can't have cancer care access for their citizens, this level of fear of cancer recurrence is high again. The general of the patient, women in general, experience a fear of recurrence much more accentuated than the men. And not at the least, somatic factors, and now there are two very, very important: cancer-related fatigue and insomnia. Because we can't rest as cancer patients, we can't sleep. Our mind, it's full of worries. So this fear of recurrence, it's increased by these worries. So these are the most important factors that make our fear being so hard to deal with, to overcome it. And instead of conclusion, to conclude my presentation for today, fear comes as natural, but hope is learned. We have to learn hope. We have to help cancer patients learn how to cope with hope. And in this way, we can overcome fear of cancer recurrence. We can't make it disappear because fear of cancer recurrence will follow every oncological patient for the rest of his life or her life. But we can control it. We can manage it. How? With hope. Thank you very much for attention. I hope it was interesting, this point of view. And if there are any questions, I'm happy to answer.
Thank you, Dr. Pogacian. Thank you for your excellent presentation. Now I'd like to open the floor for question. Feel free if there is any question about topic. So, Dr. Pogacian, as I presented, I'm from Armenia. I'm a medical oncologist. And there is another problem in developing country, this situation. And many patients struggle to express their fears of recurrence, either due to cultural barriers or personal hesitation. In such cases, is there anything oncologists can do to help? We can help them? Or is this a role that only psychologists can effectively fulfill?
This is a very good question, and the answer is not simple to say yes or no. I will start saying this. There is a short therapy named fear of recurrence therapy, created and developed by Dr. Sophie Lebel. And I'm doing now, as you mentioned, the cultural adaptation and translations into Romania, because I'm from Romania, of this 6-session therapy intervention. And as you mentioned, it is very, very difficult for me from the cultural point of view to translate it what Dr. Sophie wanted to express, because due to our cultural background, we can apply. And it's not only an issue of psycho-oncologists, of clinician psychologists that can overcome fear of recurrence. This is a multidisciplinary issue with a multidisciplinary team in a, let's say, not hypothetic, but in a normal cancer patient treatment. Yes, with medical oncologists, with psycho-oncologists, with nurses. We can work together, on everyone with its own part, to help the patient overcome this fear, because the nurses are the most important persons in all this process. Why? Because the nurses are all the time near the patients. Nurses is the first line of defense. So nurses is the first, let's say, specialist dealing with fear of recurrence. It is not only an attribute for psych-oncologists, it's an attribute also for medical oncologists, also for nurses. How? By communication, through communication. This is the first step.
Don't forget to like, comment, share, and subscribe to OncoDaily on YouTube. Hit the bell icon to stay updated.